Hey guys, welcome back to the channel. Today, we will be discussing the challenging but rewarding career of nursing. Being a nurse requires a whole lot. We got to have dedication, compassion, and we must have resilience. Yes, love, you got to be resilient if you are going to survive the profession of nursing, okay? In this video, I'm going to identify 7 reasons why being a nurse and why it's very hard transitioning as a new nurse. Why being a new nurse is hard. The first thing I want to identify about nursing being hard is nurses are asked to do what I call too much too fast. Okay, we're learning so many skills. We're learning to build mindsets, to prioritize things, to identify things, to learn medication, what symptom go with this, what symptom go with that, and things like that. I liken it to learning how to drive a car and build a car at the same time. Take a minute and just imagine doing that. We are asked to do too much, too fast. The second thing that I want to identify about nursing being hard is nurses have very hard transitions. Nursing is actually, in most cases, a second or third career for most people. So the average person is working in customer service. We're doing service work. We are doing IT, clinical, clerical work, things like that. So we have to build different building blocks in order to do this job, okay? Also, in making it a very hard transition, you have to learn to advocate for yourself and your patient. And if I just let the truth be told and be very honest, most people do not even know how to advocate for themselves yet. Now they have the added responsibility of advocating for patients. Okay. Number 3, nursing is a very emotionally demanding career. Okay. We witness patients in pain, suffering, and in most times transitioning in life. And during that time, we're expected to remain strong and empathetic, all while providing support to patients and family members. And if I just add this and say, in most cases, nurses receive lack of support themselves. That is either lack or inadequate support from your peers, from your superiors, and even from family members, because the average family member does not understand the day-to-day dynamics of a nurse, which leaves you with lack or inadequate support. Number three is we sustain very long work hours and irregular shifts. We, in most cases, work every other weekends. We work in hospital and critical care environments that is very demanding schedule and very critical decisions that we have to make on a daily, moment by moment basis, which can be physically demanding and can cause mental fatigue, which makes it a tough work-life balance for you when you're constantly bumping in and out of different things like that. The long hours, the mental fatigue, and different things like that, it just makes it very unhealthy for a work-life balance, okay? The next thing that we're going to identify is that we work in very, very high stress level work environments. It just is what it is. We make critical, quick decisions, like I said before, and we are expected to handle emergencies, very critical emergencies, with composure. We're expected to remain composed. And that type of constant pressure can lead to burnout and impact our overall well-being. We already have nurses at 6 months, 9 months, 12 months that are already burnt out. It's just the truth. The next thing that we're going to identify is that nursing is a very physically straining job. Okay, we're on our feet almost all day. Okay, we're lifting and we're moving patients, and we just perform various tasks and operations throughout the day, and it can lead to physical health issues for ourselves. Most nurses, a lot of nurses, suffer with chronic illnesses, musculoskeletal issues, repetitive strains and injuries that takes a toll on our overall physical health. Okay. The next thing, honey, we deal with very difficult patients and family members. And that, my love, is emotionally draining. We are all, honey, every day is different. You can encounter all kinds of uncooperative, angry, or fearful patients. It's a lot to even just work with a patient because we don't receive, in most cases, the adequate training to walk a person through a fear of a medical procedure or condition or things like that. Okay, the next thing that I want to talk about is when it comes to nursing, honey, we are never, absolutely never going to be paid our worth. You just may as well know it right now. I don't care what the TikTok girlies and nobody else is saying out here. I don't care what the ones that's making travel money is worth. I don't care. You will never get paid enough to go in one room and perform CPR, leave out of that room and go and make a death announcement to a family member, okay? To then walk into another room and get cursed out from a patient because you did not respond to their call light in a timely fashion while you was next door performing CPR, to leave that room and go into a next room and get urine, poop, or somebody's bodily fluids on you that puts you at risk of going home to your loved ones or even to yourself to get an infectious disease. All while being told to clock out on time, make sure that your charting is there, make sure that you attend the monthly meetings, and while you didn't do your reliance, your annual training and different things like that we are required to do. Listen, we can never get paid enough for that. I don't care what nobody say. Keep your, I said what I said. We do not get paid, and we will never get paid enough to do the job that we do. Nursing, like I said in the beginning, it is a very rewarding career, yet it is very challenging. And I wanted to identify these things, especially for our new nurses. So if you have any questions about these type of challenges and the things that nurses go through and endure, please ask or comment down in the comments. If you have some things to add to the conversation, add it to the conversation. Thank y'all for watching the channel, and be sure to subscribe, okay, for more content just like this at According to Tawanda.